Hello and welcome to the Sisters for Fitness Wellness Show. I'm Stephanie Gaines Bryant. Our guest today is Dr. Barbara Hutchinson. She's a cardiologist with the Anne Arundel Medical Center, and she's also president of the Association of Black Cardiologists. We spoke earlier, Dr. Hutchinson and I, we spoke about heart disease in African Americans. And today we're going to talk about heart disease and how it affects your sleep. Interesting subject. Welcome.
Thank you for having me.
Welcome to part 2 of the program. Let's talk about how does sleep affect your heart? Who knew?
Absolutely. I like to call sleep the sleeper of heart disease because very many people do not realize that your sleep can affect your heart. Well, first of all, think of sleep. When we all go to sleep at night, we simmer down from all the activities of the day. So you could imagine all those things that are flying around, everything simmers down, you get calm, and you're ready for the next day. We all should have at least 6 to 7 hours of sleep and be able to get to that deep sleep. But several people, while sleeping, so many things can happen. And some of the things during sleep that can affect the heart. One is, while sleeping, you can stop breathing. At the same time that you stop breathing, your oxygen level can be low. So you can go to sleep for 6, 7 hours and sleeping with your oxygen level is low. This is called obstructive sleep apnea, meaning you stop breathing for at least 20 seconds while you're sleeping. Believe it or not, that can cause several things. And I'll start with high blood pressure. How many people have had high blood pressure on 6 medications, 7 medications, and they still have high blood pressure, and they snore? Snoring, almost 50% of people that snore may have obstructive sleep apnea. So obstructive sleep apnea can affect high blood pressure. The second thing is obstructive sleep apnea with the lack of oxygen for several hours can cause your blood to become thickened. And as you can imagine, if your blood is thickened, it can predispose you to having a stroke or a heart attack. That's secondly. The other thing is not having enough sleep or sleeping, having inefficient sleep. Because if you're sleeping and you keep holding your breath, that's inefficient sleep. You're waking up every hour or every 2 hours. Inefficient sleep. That also can cause you during the day to have palpitations or skips in your heart, arrhythmias. Many people walking around today with atrial fibrillation. We now know a lot of studies have shown that atrial fibrillation, one of the biggest predisposer of atrial fibrillation is obstructive sleep apnea. So now most people presenting with atrial fibrillation, we now check to see if they have sleep apnea. So that's arrhythmias, that's high blood pressure, that's a stroke, that's a heart attack. It can also cause diabetes because it can affect your blood sugar composition. It can also affect your cholesterol. And often people who wake up in the morning that describe a morning headache need to be aware. People who wake up in the morning and cannot get going without coffee, that's another sign, because coffee can be a masker or a masquerade of inadequate sleep. You hear people all the time, I need my cup of coffee to get going. If you slept well during the night, when you wake up, you should be like the bright-eyed bunny rabbit, ready to go for the day. And if that's not happening, if you're waking up in the morning, you're waking up tired, waking up with a headache, or waking up where you really don't want to get out of bed because you want to sleep some more, even after sleeping 10 hours, that's not a good sign.
Some people don't realize they're not sleeping well.
That is true because a lot of people would just say, oh, I have insomnia. That's another thing. They may say they have insomnia, they cannot sleep. But when you do the testing, they actually slept, but their sleep was inefficient. They never got to that deep level of sleep. Let's talk about some of the signs that people may present with or tell you that could clue you in that they may have a problem sleeping. It's now 8 o'clock in the morning. Someone is having a conversation, they slept, and they're falling asleep during the conversation, 8 o'clock in the morning. They feel tired all the time. You're driving in a car and you're not 100 yards gone and they are asleep already. People that snore. People that wake up a lot during the night to go to the bathroom. Very often, if it's a male, they will say, oh, it's his prostate. But if you are a woman that's waking up 5 times during the night to go to the bathroom, you do not have a prostate. So you have to think of other things that could be triggering that, because sleep apnea can also affect the bladder.
What about conditions such as narcolepsy?
Narcolepsy is another sleep condition where people, they just fall asleep very easily. Now, the narcolepsy, it's a more central problem where they have insufficient quantities of certain substances in their brain. And so the treatment for that is a little different. They do not have obstructive sleep apnea. Their problem is not obstruction that's causing them not to sleep. It's just that they have an imbalance in the brain that results in that.
Now, many of us deal with a spouse who snores at night, or you yourself might snore. Mm-hmm. How do you deal with a snore? What I do, I push him over.
Yes.
I roll him over.
Most people do that. Most people would push them and roll over. That's why sometimes the men come in complaining of rib pains from all the punches during the night. And I'm saying those rib pains, what we are actually doing. And by the way, we say men, but there are some women that snore more than men. The thing that I would say about that, it's important to get help. And I'll share a story with you. A 31-year-old that came to visit me, and she had a little boy. She said, oh, I'm raising him by myself because my husband died. And I said, 31? I said, how old was he? He was 30 years old. So I proceeded to ask what happened. She said, well, my husband, he would snore every night, and I would always push him and turn him over. But one night, he wanted to look at a game. So he went over to a friend's house and they watched the game. And after the game, he decided to stay over there to sleep and not come back home. But what he did not know is that his friends didn't know that he had sleep apnea. So his friends heard him all night, you know, and they didn't know to touch him and turn him over. And unfortunately, he died. And she is really upset with herself because she realized she was aiding and abetting. She never thought that he can get help. And there are many people out there now with spouses or bed partners that snore. And you are aiding and abetting, just rolling them over. It's important to have them be tested specifically for obstructive sleep apnea. Because one, it can be treated, and secondly, it can prevent them from having other cardiovascular problems. We talked about the high blood pressure, diabetes, high cholesterol, arrhythmias, a stroke, a heart attack, and obviously dying suddenly during the night.
But isn't some snoring normal?
There's some snoring that could be normal, because really what the snoring is when you lie back, your tongue falls towards the back of the throat and obstructs the airway. And that's the sound that you hear from snoring. So there are some people who snore and it's just the noise of that sound that you hear. They don't necessarily have obstructive sleep apnea. But 50% of the people who snore, and similarly, you can have obstructive sleep apnea and not snore. You are a quiet sleeper. And although you're a quiet sleeper, there's still times where you hold your breath for up to 20 seconds during the night. So it's nothing like being tested and finding out definitively if you have it, because it's treated and it's treatable.
Now, you are one of the few doctors in Maryland who's certified in both cardiology and sleep.
Sleep medicine, right.
So sleep medicine. What made you decide to go into sleep medicine?
I got lots and lots of consultations for young people who were fatigued, or young people on 6 medications that were still not well controlled with their blood pressure. And the reason they sent them to me is because they thought they were fatigued because they had a heart problem. But when I questioned them, most of them would be tired at 2 p.m. in the afternoon, driving home from work. They'll be falling asleep at the traffic light. And I said, this is more than heart. This is something with their sleep patterns. And I started reading and recognized there was something called obstructive sleep apnea that presents these symptoms during the day, marked fatigue during the day, falling asleep at the traffic light, that can result in really uncontrolled high blood pressure. And the more I looked at it and started treating these people, I saw great results in terms of their blood pressure. They went from being on 6 medications to being on 3 medications. And in some people, once they were treated, some were even able to get off of their blood pressure medications. So that's the curiosity that led me down this road. And then I found out later, people that I treated for atrial fibrillation that were in the emergency room once a month with recurring episodes of atrial fibrillation, once I looked into their sleep pattern and recognized that they had sleep apnea, treated them, all of a sudden I hadn't seen them for 2 years because they were no longer having these recurrent episodes. And that's clearly what the literature says. If you have atrial fibrillation, despite all the technology that we have now, the ablations, the medications that we can give, if we do not treat the driver, which in this case could be obstructive sleep apnea, we would not be doing our patients a favor. They would keep coming back and we'll keep doing procedures unless we go back and treat the driver, obstructive sleep apnea.
What are the treatments that are available nowadays? My sister did a sleep study, and now she has to do this mask thing, this kind of Darth Vader mask. Are there any things that are less invasive?
Yes. When we think of obstructive sleep apnea, there are several treatments. One is you can wear a dental device in your mouth during the night that pulls your jaw forward. And in pulling the jaw forward, it opens up the back of your airway. This is usually something that's made specifically for you through the dentist. So there's a whole group of dentists now that are called sleep dentists, and they make these dental appliances or mandibular advancement devices. That's one way. Secondly is CPAP, or continuous pressure that is introduced into the airway while you sleep. And that involves putting a little tube either in the nose, over the nose and mouth, or over the face. So there are different face or different masks that one can use. So that's the second thing, that is CPAP. Thirdly, you can have surgery because sometimes the back of the throat is just overcrowded. The tongue is too large, and all your uvula, the back of the throat, could be too large. And so sometimes the surgeon can go into the back of the throat and shave off these enlarged structures. But that's an invasive procedure.
Well, have those been successful?
They have been successful, but in some cases, some of those organs have grown back, and I've seen that.
Interesting.
It can grow back. So that's one, but that's invasive treatment. But now there's a new technique where, just like you can have a pacemaker in the heart, you can have a pacemaker that's attached to the muscle under the bottom of the jaw that paces you during the night to keep the airway open. And now that's used. Several centers around the country is doing that procedure, especially for those patients that have severe obstructive sleep apnea that cannot tolerate the CPAP or the mask, because in those patients you need to find something, and so that's another technique that's now being used, pacing that nerve on the bottom of the jaw.
So is part of the process in finding out whether you have one of these conditions, do you have to do a sleep study? What's the process? You go into the doctor, and then what? Do you have to do this whole night sleep thing?
You can do a sleep test, but now people always say, well, I don't want to sleep outside of my home. The good news is that some of these initial sleep studies can now be done at home. So you can do a home sleep study to determine if you do have obstructive sleep apnea, and if you have low oxygen that's occurring when you sleep. The second thing is that once we identify that, now we have to treat you, determine what pressure do you need applied to the back of your throat to keep those structures open at night. Now you can come into the lab to have that titration testing done to determine what pressure you need, or now it could also be done at home by doing an auto titration at home, in the home. So there's testing. And now what we do, in addition, we take it a step further. We actually have a whole sleep management program. So you've been tested, you're now on the machine. Our duty is to ensure that you are compliant with the machine so that you can continue using it such that it doesn't impact those other cardiovascular problems. And so we have a clinic, a sleep clinic, where you can come, we can check to see if the pressure is adequate. Is the mask that you're using, is it leaking? Does that need to be adjusted? Do you need a different type? Do you need a different machine? All these things to tweak it such that it's optimized for you.
How does what you do during the day affect how you sleep at night? When we did our show on heart disease, we talked about diet and exercise and how those things affect whether or not you're more prone to heart disease. How does that affect your night's sleep? For example, if you're suffering from obesity, how can that affect whether you get a good night's sleep? If you're suffering from diabetes, how does that affect? How does what you eat, if you ate spicy foods before bed, how do these environmental issues affect sleep?
It does, because a lot of times there's such a thing called sleep hygiene. What do we do before we go to bed? And now technology and sometimes our jobs during the day, if you have a high pressure job where you're thinking all during the day, you have to be on your feet making quick decisions. Sometimes that's difficult to turn off as soon as you get home. So you need this little wind down time. But what often we do is when we get home, we're in front of the television, we're on our iPhones, we're on our iPads, and the light, believe it or not, from all these equipment affect how quickly we go to sleep. Because you remember, there's a substance that's produced in our body that enables us to go to sleep, but that substance loves darkness. So when we sleep with all the lights blaring, when we sleep with the phones on, the light from our iPad or cell phones, that impacts our sleep because it's indirectly decreasing the amount of that substance that's produced that enables us to have a comfortable night's sleep.
So what should your sleep hygiene be?
The sleep hygiene should be when you get to the bedroom, that the bedroom is for sleeping.
No TV.
And turn the, purpose to turn the television off at a certain time. If you want to be in bed by a certain time, turn the television off, darkness, such that you can go to sleep.
And what about your sheets? What about the temperature in the room?
Yes.
I'm
glad you brought that up, because we now know that the cooler the temperature is, the more restful the sleep is. So if it's very, very hot in the room, it's usually not amenable to good, restful sleep. The cooler the temperature is, the better it is.
One of the things I get, one of the most frequently asked questions I get as a yoga instructor, how can I calm my mind so that I can sleep better?
Mm-hmm. And there again, in terms of calming your mind, has to do with what are those activities that you're doing just before sleep. Because if you go to exercise for 2 hours just before sleep, you could imagine after that it would take a while for your mind to calm down. As opposed to just before sleeping, you decided to listen to some classical music or just some waves breaking in the ocean. So it all depends on what happens just before sleep. So you can calm your mind with certain things before sleep.
How about what you eat before? Is there a time, should you avoid eating 2 hours before sleep, or how should that work?
That's also an interesting question, because we also know that people who have sleep apnea are prone to having acid reflux, where the acid reflux is up when you're sleeping. And for those patients, we often tell them, you shouldn't be eating a meat and potato dinner after 6 o'clock in the evening. You should cut it off such that your body isn't churning out all this acid while you're sleeping that really aggravates your acid reflux at night.
So you just made a good point. Don't don't eat those heavy meals
Late at night. And you know, we talked earlier about obesity. That is the best way to gain weight. Because you think of it, you have a heavy meal at 9, 10 o'clock at night. There isn't enough time after that to work off that meal before you go to bed. So very often we have a very heavy meal after we go to sleep, and that's the easiest way to gain weight.
So, in wrapping up the show, when we, if someone believes that they have a sleep issue, what should you look for? If you're find that your spouse or your bed partner is snoring at night, don't enable that person. Don't roll them over. Do something.
Absolutely, and the thing to do is to get them help, have them be tested to see if they have a sleep breathing problem. And that is having a home sleep testing or an in-lab test to determine that.
And how many hours should we be? Because
Six.
everybody wonders that. Am I okay because I get 6 hours? And then two, what about those overnight workers? I know a couple of nights a week I do the overnight shift on at my radio job. Are you more prone to things like sleep apnea if you've got those erratic sleep habits?
Well, the shift workers, the overnight workers, they are prone to other sleep problems because their night and day is now reversed. But in terms of the number of hours that they should sleep, it's still the same. It's just that if you work during the night and you get off in the morning, there are certain things that you should do even as part of your sleep hygiene in terms of the drive home with the sunlight in your face, wearing dark glasses so that it doesn't impact you. And even during the night when you're working, the light that's there. So there are different sleep problems that shift workers have that can also affect them. They may not necessarily have obstructive sleep apnea, but it's more circadian problems in terms of sleep.
What are some of the other issues they can come across?
Well, in terms of the
Because yeah, there'll be a lot of shift workers
Right.
who may be watching
Right,
this.
because the shift workers, when they get off in the morning, when they get home, because it's now night for them, is making sure that the curtains, they can darken the room. Because again, you remember I told you that substance that enables you to go to sleep loves darkness. So if you get home, because now it's during the day, trying to sleep during the day when the sun is up, it's harder. So you have to make the room now conducive, darkening the curtains to make sure it appears as if it's night so that you can get those 6 hours sleep.
Do you know, Dr. Hutchinson, it makes you wonder how many people who died in their sleep, you think they died of a heart attack, when they might have died from some sleep-related disorder. That's interesting.
Absolutely. And there's actually a study that I saw recently that talked about shift workers, people that work at night for a consistent period of time at increased risk of having heart problems.
Wow. So in wrapping up the discussion, let's talk one more time about the sleep hygiene, what you should make sure you're doing or what your loved one should watch out for with you so you don't have a 31-year-old passing away.
Yes.
So tragically.
We should not be enablers. If we identify that our bed partners snore, not just make it a joke, but actually think of that as being a cause of something else. So get them help. Find out, have them have a sleep study to make sure they do not have any sleep breathing problem. If they do, they should be treated because it's treatable. Even if they do not want to use the CPAP, probably trying first a dental appliance, asking your dentist if they make it, or seeking a sleep dentist to make that appliance. If that still doesn't work and the person has severe sleep apnea, they should also investigate having other ways of treating them.
So there are levels
Yes.
of sleep apnea.
Sleep can be determined, it could be described as mild sleep apnea, and that is if you stop breathing up to between 5 to 15 times in 1 hour. If you start breathing between 15 and 30 times in 1 hour, you have moderate. And if you start breathing more than 30 times in 1 hour, you have severe sleep apnea.
Wow. This has been a very interesting discussion, and I hope folks got a lot out of it, because it's something we all have to do. We all have to go to sleep, and you want to make sure that that rest time is a time of restoration, where your body can heal, where you can get a good, you said 6 to
7 hours.
6 to 7 hours.
And one thing I should say, though, is that it's just as bad if you sleep too much. So too little sleep and too much sleep, it's like it's a U-shaped. So that 6 to 7 is the optimum. Those people who sleep too much, hypersomnia, that is just as bad, because it can also cause other problems.
All right. Thank you for joining us. We've been talking to Dr. Barbara Hutchinson. She's a cardiologist with the Anne Arundel Medical Center and also the president of the Association of Black Cardiologists. And you're one of the few doctors here in the state of Maryland who is certified in sleep
And cardiology.
So in other words, you know your stuff.
Thank you very much. It was nice having me.
Well, the last question is, do you sleep well?
I do. I try to get at least 6 hours of sleep.
Did you have to learn it, or is it something that you just were doing?
No, what I realize is that I function optimally when I get those 6 hours. If sometimes for whatever is going on, and you travel and you have to sleep less, you realize you're not at your peak.
Okay.
And that's the other thing. Optimal sleep enables you to function maximally.
Indeed it does. Thank you so much for joining
Thank
us.
you.
I'm Stephanie Gaines Bryant. You've been watching the Sisters for Fitness Wellness Show. Have a great day.